Hi, Mr. Templeton.
Hello.
I just wanted to stop by. My name's Jessica. I'm your nurse, and I just wanted to talk to you about your asthma diagnosis. How long ago did you find out you had asthma?
Earlier today.
Okay, so relatively recent.
Yes.
Okay, and so have they prescribed you any medication that you're aware of for your asthma?
The doctor did say something about albuterol.
Okay. Yep, I have your albuterol inhaler right here, so we can give it some practice. And so I just wanted to teach you through the disease process. Basically, there's two main components that happen when you have asthma. You have the bronchoconstriction portion, and so you have the muscles in your airways, they are constricting, so they're contracting, and so you have a narrowing, so it makes it harder to breathe. And then there's also the second portion, where you can have inflammation, and so you have swelling of the cells in your lungs, and then you also have some mucus secretion that happens. And so those two main portions, the bronchoconstriction and the inflammation, are what cause those collective symptoms that you experience when you have an asthma attack. And so whatever your triggers may be, you'll figure them out as you go. We can help you with that, but there are several things that may trigger. It's basically an overreaction by the body to a certain substance. And so some people have a baseline, they're always symptomatic, and so they may have to use medication for that, versus what it seems like for you, you just have a more so short-acting medication that you would use, and so to alleviate those acute symptoms. And so with asthma, there's several different triggers, and so it may be allergens, it may be air pollutants, it may be foods, chemicals, a respiratory infection can also trigger it, and then also as well as like stress. And so with some people, they have like exercise-induced asthma, and so they would need an inhaler for that to alleviate those symptoms. And so the most common signs and symptoms of asthma, you have like the shortness of breath, like the dyspnea, that's what it's called. You would also have some wheezing, so people might tell you, oh, you sound a little wheezy. And then you'd also have like some cough, is a very common symptom of asthma as well. And so did you experience those when you had your asthma attack?
Yes, I did.
Okay. And so if you don't address those signs and symptoms, if you don't have a med for that, to inhale to alleviate those symptoms, you may go further on to have like hypoxia, so your body cells are not getting enough oxygen, so you might have you may start sweating a little bit, you may have some shaking, and basically your body is just telling you you don't have enough oxygen, and that's what the inhaler is for. And so there's the two different types. You can have like a chronic condition where you have to have long-acting medications, and then you can also have where you just need the short-acting medications for that. And so the albuterol inhaler is a short-acting medication, and so it's called a short-acting beta agonist. And so with this medication, it basically relaxes the muscles in your lungs, and so that way it opens the airways and you can breathe again. And so this is your inhaler. This is what you'll be using whenever you feel that shortness of breath, whenever you feel wheezy and you just can't get enough air. And so another type of short-acting medication would also be anticholinergics. So a common one is ipratropium, but if it's not prescribed to you, you don't have to worry about it too much. And then another medication that can be used for acute asthma attacks would be systemic corticosteroids. And so basically steroids, they are going to be affecting the immune cells in your body, basically trying to decrease the inflammation that is going on in your lungs, trying to decrease that mucus secretion as well. But most commonly, you'll just be using your short-acting beta agonist, your albuterol, for your asthma attacks. And so those are the most common short-term quick relief medications that you would use. You only use those for asthma attacks versus long-acting medications. They don't work to stop the signs and symptoms that are going on with an asthma attack. The long-acting, they basically help to alleviate the symptoms for people that have a higher severity of asthma going on. They alleviate the symptoms so they're more manageable to live with on a long-term basis. And so long-acting beta agonists, so similar to albuterol, there's a different variation of albuterol that's long-acting. It also works to relax the airway muscles, and so you can breathe just on a longer-term basis. There's also inhaled corticosteroids, so with those you would be inhaling the steroids, trying to decrease the inflammation. And then the third common med is immune modifying drugs. And those ones aren't as common, but they can be used to also work on those immune cells, decrease the inflammation, decrease mucus production, so then you can breathe easier as well. And so, but you have the short acting prescribed to you, and that's what we'll go over. And so, but also just as a side note, depending on the severity, some people do have severe enough asthma that they use something that's called a peak flow meter. And so you would forcefully expire, you'd exhale into this peak flow meter, and then based on what your norm is, how much you can, volume basically you can expire over time, you would have your norm, and then based on what it is showing you, it may indicate whether you need to use your inhaler or not. But those are for people that have basically higher severity of asthma, and they use that peak flow meter basically as an indicator for when they need their meds or not. For you, it's just more so symptomatic if you feel short of breath, if you feel wheezy, if you feel like that you just can't get enough breath and you've been coughing, it's a good idea to use your inhaler. And so when you use your inhaler, you would start by, so you either want to be sitting upright or you want to be standing for this. And so basically that just allows adequate chest wall expansion so you can get as much of the med in your lungs as you can. And so before you get started, you just want to look at the medication, make sure it's the right medication, that's the short-acting albuterol. You'd make sure that it's prescribed to you, make sure the dose looks okay, make sure it's not expired, so you just check over the medication, make sure it's the right one. People that have several meds, they want to be very careful about this so they don't mix them up. And so you just look over it, make sure everything's okay, and then you'd go ahead and shake it a few times. After you shake it, when you're prepared, you would do a deep exhalation, so you would breathe out as much as you can, and then you would put it 1 to 2 inches in front of your mouth with your mouth open. And so you would then, as you begin to inhale, you would then depress the canister and you would breathe that in. And so you would breathe it in and you try to hold it for about 10 seconds. And if not possible, that's okay. And so then you would breathe out with pursed lips. It's hard to see with the masks, but you'd breathe out nice and slowly. And so with this, you're basically trying to create a fine mist in front of the inhaler, so then that way you can breathe that mist in when you're inhaling, when you're using this. However, it takes a little bit more coordination, so if you so wish, we can send you home with one of these spacers. It goes on the end just like this. And so with this, you take the medication in 2 to 3 breaths. And so you take off the cap, you can wash this whenever as you need. And so you would take it like this, same thing, you sit up nice and straight, you exhale, get rid of all the air in your lungs, and then you create a seal around the mouthpiece. So you put it in your mouth and you create a seal. And then as you begin to inhale, you depress the canister and you breathe in. And then you would do several breaths, so you breathe out through your nose, and then you do 2 to 3 breaths until all the medication in the chamber is gone. And so that way you don't have to coordinate as much the inhale with the depressing of the canister. So oftentimes it's easier for kids and for older adults to use a spacer. And so we can have you use one of these if you'd so like. And so when you use a puff of the albuterol, you typically wait 1 minute before you use another puff, before you do it one more time. And then it just depends on what your doctor prescribes you, how many puffs to do whenever you have an asthma attack, so to say. So I'll hand these 2 pieces to you so you can go ahead and show me how you would do it.
Okay, so first thing I'm going to check is to make sure that it's the right medication. So it is the albuterol. After that, I'm going to make sure that it's the correct dosage. And then check the expiration date to make sure that that's still within standing. And then prior to using it, I'm going to shake it. And then once I'm done shaking it, I'm going to hold it up to my mouth about 1 to 2 centimeters, you said?
1 to 2 inches.
Or
Yep.
1 to 2 inches. Okay, and then after that, I'm going to inhale. And as I inhale, I'm going to press down. And I'm going to hold that in for about 10 seconds. And then after 10 seconds, I'll exhale. And you said to do it within in 1 minute increments, correct? So
Yep.
after 1 puff, wait another minute, and
Yep.
then I can use another puff. Okay. And then to use the spacer, same thing, shake it, and then I'm gonna insert it. I'm gonna take this cap off, and then I would form a molding of my lips around the cap, correct?
Mm-hmm.
And then I'm going to press down as I'm inhaling, then I'll press down, and then I'll hold that in, and then I'll exhale. And then I should have about another 2 to 3 breaths inside the spacer that I can inhale and then exhale and continue.
Yep.
Okay.
That sounds about right. And then just to recap, so you're going to be going home with this, and if you want, you can also take the spacer as well. And so just to recap everything that we've learned over this time, what were those 2 main components of asthma that we had talked about?
It was bronchoconstriction and inflammation.
Absolutely. And then also, what type of medication do you use for an acute asthma attack?
So it would be a short-acting, something like albuterol that I'm
The albuterol
prescribing.
that you have. Yep, that's absolutely correct.
Yep.
And then I saw how you would use your inhaler, and I think you're good to go home. We'll send you home with some discharge instructions about how to use it. It's all in written format. And thank you so much for your time.
Okay, thank you.